All right, so just a little bit about me. I am a licensed naturopathic doctor currently practicing at Naturopathic Living, which is right in Unionville. I do have a special focus in women's health as well as hormonal conditions, but a topic that's near and dear to my heart is, of course, supporting skin conditions such as eczema and acne. I work to empower my patients with proper education so that they can make informed decisions about their healthcare. And I also provide personalized strategies so that you can improve your quality of life and be prepared with the know-how in order to maintain and manage the health conditions that you're struggling with. And I do this by incorporating a combination of different modalities, such as diet and nutrition, stress management, utilizing supplements and herbs when appropriate. I also am licensed to perform acupuncture, which we'll also chat about in this presentation. And I'm also able to provide requisitions for lab testing as well as other functional panels, which we will also touch upon in the course of this webinar. All right, so this is the overview of the topics that I will discuss today. So we'll first go through eczema, the common symptoms and presentations, the common causes of eczema, treatment options, as well as the maintenance plan that I will discuss after supporting or alleviating the main symptoms. So what is eczema? It's also known as atopic dermatitis, and it is a very, very common condition that does impact 10 to 20% of Canadians. What really sets eczema apart is that it is a skin condition which can present in many different ways for different people, but the typical symptoms will be dryness, very itchy skin, redness, and the redness will present differently depending on the pigmentation of the skin. And we'll look at different ways that the eczema can present. There also may be flaking skin, scaling skin. It may present as red or brown patches and bumps. There are also different forms of eczema, such as dyshydrotic eczema, which typically presents as little fluid bubbles or blisters that typically occur on the fingers or on the feet as well. And there's also nummular eczema, which presents as sort of ring shaped patches, typically on the lower part of the body. De- Despite the different presentations, the underlying mechanisms are very common between the different forms, and the treatment is also very, very similar. And eczema typically presents or develops during infancy and childhood, but there are cases of people who tend to develop eczema later on in life. All right, so as I mentioned, there are different types of eczema, and typically they present differently in the different age groups. So in infants, you'll see eczema present primarily on the face. It can also occur on the scalp, hands, and feet. In older children, it typically will develop on the knee and elbow flexures. So that's in the folds of the joint, as well as on the neck. And then in adults, typically it'll affect the hands, the wrists, ankles as well. For some people, there's also a common presentation of the rashes on the flexures of the knees and elbows, and it can occur around the eyes as well. All right, so these are different examples of how eczema can present. So as you'll see in the top left corner there, the skin is very red. There is a very ill-defined sort of patch of skin that is red in comparison to the left bottom photo where there's more of a gray scale or a dry skin type of scaling that's occurring. In the top right, you'll see that the eczema can present as more dark brown, purple, or gray, especially for individuals who have darker pigmented skin. And then, of course, on the bottom right, this is the typical presentation that we see in younger children, such as infants and toddlers. But as you can see, the common thread is that there are patches of skin that are very red, inflamed, dry, scaling, and it can be very, very itchy as well. So there are some typical causes of eczema that I discuss with my patients in my practice, and these include genetics or the hereditary component of eczema. There's a common thread of the impaired skin barrier. There is overactive immune function or hypersensitivity involved. Stress can be a very, very big trigger for many people. And we'll also discuss the environmental allergens that can often trigger eczema as well. So, the genetic component, typically we see that eczema will run in families, and there's a greater risk of you developing eczema, especially if your parent either has eczema or presents with the atopic triad, which is the three, um, the combination of three things, including the eczema, asthma, and allergies. So the allergies I'm referring to are more like hay fever, where you are having those seasonal symptoms such as sneezing, itchy eyes, watery eyes, itchy throat, which usually occurs during the spring and summer, especially when there's more pollen exposure or grass exposure during the summer. And the genetics or the genetic component often will involve a variety of genes that code for proteins within the skin barrier that become more faulty, meaning that mutations in these genes can cause issues with the skin barrier and skin barrier permeability, which will often lead to more irritation, more inflammation, and can trigger an eczema flare. So when we're discussing skin barrier dysfunction, this often involves a mutation in the gene that encodes for filaggrin. And filaggrin is a protein that sort of acts like the mortar that keeps the skin cells tightly closed together, preventing bacteria and other irritants or toxins from entering the layers of the skin. But for people who have eczema, there usually is a mutation in this gene, which prevents the skin cells from being tightly packed together, and therefore there are more holes and gaps between the cells that then allow for irritants and bacteria to enter the skin barrier. And this is usually what causes that triggering of the immune response or inflammatory response, which leads to the rash like presentation involved in eczema. And with this filaggrin mutation, we often also see increased water loss, which is also why the skin tends to feel more dry and flaky. So this is a really nice visual about the differences between a normal skin barrier and the skin barrier in a person who has eczema. So as I mentioned, the filaggrin protein here, which on the left side is demarcated by the brown lines that attach the different skin cells together. You'll see that in the skin barrier diagram for eczema prone skin, there's a lack of that protein there. And so rather than the skin cells being very stratified, layered, and organized, there's more disorganization within the eczema skin barrier, and that allows for those gaps to appear and for bacteria and other irritants to more easily penetrate the skin barrier. And you'll also see that in terms of the oils and such, there are fewer lipids as well in the eczema skin barrier. And this is a huge opportunity for us to, so now that we understand the differences between the different skin barriers, we can be more proactive in addressing some of these factors so that we can reduce that skin barrier permeability. So the immune component is really, really key, especially in terms of the progression of eczema or the frequency of flares, because what's happening here is due to the fact that the skin is allowing irritants and bacteria, for example, to enter the skin. These these allergens or irritants are met with an immune response where the immune system is detecting foreign invaders, and because of that it's launching an inflammatory response which leads to the release of pro-inflammatory mediators such as cytokines, interleukins, and this increased influx of these chemical mediators oftentimes will contribute to that itching, that swollen skin, and the redness, which of course is very characteristic of how eczema typically presents. As I mentioned, stress is a big trigger, and it's something that I see in many, many of my patients, whether they are younger or adults. So, of course, with stress, what happens here is that we are triggering a cortisol response, which can increase inflammation and further disrupt that skin permeability. It also can contribute to that vicious itch scratch cycle because what happens is that, increased stress can trigger an eczema flare, but depending on the severity of the itching, which oftentimes can cause people to awake during the night while they're sleeping due to the discomfort, or how or whether it's spreading to a very large part of the body. It can be a source of stress for many of my patients as well. So this vicious stress cycle is something that we work on breaking so that we can calm down the flare and work towards healing the skin and alleviating the symptoms. Environmental allergens are oftentimes big triggers for eczema as well. And as you'll see here, it's a combination of exposures outside as well as inside the home. And there are materials such as latex and metals, which can cause more contact dermatitis, which is more localized to the area of skin that is exposed to these allergens. Fragrances are key because we're not just talking about perfumes and scented body care products, but this also includes things like candles or fragrances found in detergents and soaps. Pollen and mold, of course, are environmental allergies that can be common depending on the time of year as well as the humidity within the home, especially basements. Dust mites, pet dander, of course, are also very, very commonly found in the home. So in my practice, these often come up as primary food triggers for people who have eczema. And what I usually find is that ingestion of these triggers, especially in high amounts or infrequent amounts, can oftentimes trigger flares. So dairy and gluten, I would say, are the most common triggers for the patients in my practice. And often what we see is even when you work on temporarily alleviating these triggers during times of flare-ups, it can significantly help to alleviate some of the symptoms that you deal with during the flares, especially the itching and the redness of the skin. So now that we've covered, what eczema is, the pathology underlying it, and then common causes of the condition, these are the conventional treatments that oftentimes dermatologists as well as doctors will prescribe to their patients. So the most common I would say would be the corticosteroid creams. So that's the Betaderm, the hydrocortisone, and these creams are applied topically onto the affected area. The risk with long-term corticosteroid use, and by long-term, I mean over a 1 year period, is that the topical steroid creams can often the thin the skin, which then can contribute to more frequent eczema flares because of the dryness and water loss. Some people also develop what's called topical steroid withdrawal syndrome, which which means that once they stop utilizing these steroid creams, they may develop eczema on other areas of the body that weren't affected before. And the presentation oftentimes can be much, much more severe than how their primary form of eczema presented. So some people will have, skin that's peeling, skin that is very red, skin that feels like it's burning. So one of the things that I often counsel my patients about is the use of these corticosteroid creams, and of course using them very sparingly, only in instances where they're needed to alleviate itch and such when nothing else seems to work. Other prescriptions that are common are the topical calcineurin inhibitors, such as Protopic. So this is a non-steroidal option that really targets the blocking calcineurin, which is a protein that is involved within the immune response that can often lead to the triggering of eczema flares. So creams like Protopic help to block this chemical, which can help to alleviate the eczema and to help reduce that inflammation there. Oral corticosteroids like prednisone are only used in the most severe forms of eczema. And so I really don't see this being prescribed commonly or regularly to patients because, again, it's really reserved for those very severe presentations, especially when nothing else seems to work, because the way that this medication works is that it suppresses that immune response so that we can reduce that inflammation, which then leads to the skin getting becoming more calm and less inflamed. But of course, there's the potential for quite severe side effects with prednisone use. And so when I do see it being prescribed, it's only for a very, very short course to help to manage the symptoms. Biologics are a very specific class of medications. And an example here is Dupixent. It's administered as a subcutaneous injection, either on a weekly basis, bi-weekly basis, or once a month for patients, depending on the severity of their eczema. And biologics target a very, very specific um, receptor within the immune system. So therefore, there often are fewer systemic side effects in comparison to treatments like the prednisone. I do see antibiotics being prescribed often, especially for patients who tend to be prone to skin infections, particularly if they're itching and scratching a lot. That often causes tears within the skin where bacteria can be introduced and contribute to that infection. So that's where antibiotics are typically used. And then phototherapy or light therapy is oftentimes prescribed as an adjunct, particularly by dermatologists. And this involves the controlled use of UV light to alleviate inflammation. And we'll compare that with red light therapy, which is a modality that I often recommend to my patients. So in comparison to the prescriptions that are often prescribed for patients who struggle with eczema, you'll see here that the naturopathic approach is more holistic and all-encompassing and really addresses many of the body's organ systems that are involved in regulating the immune response, and that includes the gut, the immune system, as well as the liver. We'll also discuss strategies for improving the integrity of the skin barrier so that it's less permeable, so that it's able to retain more moisture and hydration. And we're also preventing water loss. We're also going to chat about different stress management options as well, because as I mentioned before, stress is a very, very common trigger, especially within my patient base at the clinic. So, when we are addressing the inflammatory response and that hypersensitive immune response, a key piece here is that it's important that we identify your food triggers. So, there are different options to do this, and one is the elimination diet, where we are completely eliminating a uh, wide range of the most common food sensitivities. So as I mentioned before, dairy, soy, wheat or gluten, peanuts are very common. The elimination diet as a whole can be very, very restrictive because we're also eliminating things like caffeine and alcohol and sugars as well, because these can often flare symptoms for individuals. So the elimination diet, although it can be very restrictive, it can provide the body with a period of several weeks in order to heal and in order for that inflammatory response to dampen. At the clinic, we also provide the option of an IgG food sensitivity test. So what this looks at is the immune response that's being directed towards different food antigens or different proteins within foods. And the IgG food sensitivity test is performed through a collection of a blood sample, and your blood sample is then tested against the different food antigens. And we do offer a variety of different panels, both vegetarian as well as for omnivore diets. We also offer a more specialized panel that can provides a variety of more ethnic or cultural foods as well. And the way that the IgG food sensitivity test is interpreted is the report that it gives back gives us a range of antibody activity against each individual food. And the more severe or the stronger that antibody response, the more severe the sensitivity or allergen is in terms of kickstarting that inflammatory response. So this is oftentimes a more convenient way to identify those food triggers. And once we've been able to identify the food triggers through the test, I usually recommend a period of elimination from 4 to 6 weeks, again, to allow the body to heal without being constantly triggered by the foods. And with this, I will pair the anti-inflammatory diet, which consists of very high fiber foods, lean proteins, which are lower in saturated fats. So proteins such as beef, pork with higher amounts of saturated fat, unfortunately, can be more pro-inflammatory for the body. And that's why I usually recommend more poultry and more fish when possible. This is also combined with low glycemic index, which means that we are looking at foods that tend to prevent dysregulation in blood sugar. So rather than seeing spikes in blood sugar, we're able to better stabilize blood sugar throughout the day. And an example diet that I often recommend is the Mediterranean diet, where we're incorporating a lot of whole foods such as fruits, vegetables, legumes, lots of good quality oils like olive oil, nuts and seeds. And this I find is less of a restrictive diet, but one that is not only nourishing, but also providing a lot of the anti-inflammatory benefits that can help to dampen that immune or pro-inflammatory immune response. Antioxidants can be very, very helpful to reduce that inflammatory response. And the ACEs and zinc stands for vitamins A, C, E, as well as mineral selenium and zinc. So all of these in combination really help to uh, reduce free radicals, helps to also stabilize that immune response so that it's not so um, overstimulated. NAC stands for N-acetylcysteine, and it is an amino acid that is a precursor for glutathione production. Glutathione being one of the body's most potent anti-inflammatory nutrients, which also help to support healthy detoxification and helps to dampen that inflammatory response. Other ways that we can reduce that inflammation, as I mentioned before, is red light therapy. So red light therapy uses near red, infrared, or red light to calm inflammation within the skin. It can help to stimulate collagen production, which can help to repair the skin barrier so that it's not so porous or permeable. Vitamin D is an essential nutrient here because it helps to modulate the immune system so that it's less hypersensitive. It also helps to reduce cytokine production, which again is the chemical mediator that oftentimes will contribute to the itching, the swollen skin, and the redness within the skin. During this time of year, when it's dark, when it's cold, I oftentimes will recommend a higher amount of vitamin D supplementation, usually between 2,000 to 5,000 I use each day. And of course, vitamin D is something that we can test through blood work to ensure that your dosing is sufficient. We also work on reducing irritating exposures, fragrances being a key factor here. So one system that I find my patients usually don't put together when we're discussing eczema is the gut and the digestive system, because what happens here is when the body is so inflamed, either due to that overactive immune response or by stress, for example, is that the gut lining also becomes more permeable, similar to that skin permeability or that permeable skin barrier that we had discussed earlier on in this presentation. So what happens here is that there are gaps within the cells lining the intestinal wall. And because these gaps are present, they allow food particles, toxins, as well as bacteria through the gut lining and into the bloodstream, where again, it triggers that pro-inflammatory immune response. So part of our work here is also to work on repairing that the gut barrier so that it's less permeable. And some of the nutrients that are super effective in doing this are L-glutamine. So L-glutamine is an amino acid that helps to tighten the junctions between the intestinal cells to reduce that permeability there. It also acts as fuel for the enterocytes, which are the intestinal cells, to promote healthy intestinal function. Many of these cells as well are responsible for secreting digestive enzymes, which help to facilitate nutrient absorption and food breakdown. So L-glutamine typically comes in a powder form, which you can easily add to water, a beverage of your choice, or blend it into a smoothie. Typical dose for my patients is around 5 grams a day. Probiotics are also essential for gut repair because they help to modulate that inflammatory response and helps to provide or support more of a healthy microbiome, which allows beneficial strains to thrive and to colonize, therefore outcompeting the more pro-inflammatory or pathogenic strains of bacteria. And this, again, is often a daily prescription for my patients who are struggling with eczema. And we're looking at products that provide a good dose of lactobacilli and bifidobacterium. Probiotics are best taken with food. So that's something that we often will incorporate into the eczema care plan when I'm working with my patients. Bone broth is also a therapeutic food that I often recommend incorporating just as a daily food. And bone broth can be used in soups and stews, which are particularly nice during this time of year. And bone broth provides an essential source of minerals as well as collagen and gelatin, which aid in that recovery of the intestinal barrier. The collagen also soothes the gut lining and is a source of hydration for the skin as well. Detoxification, of course, is key here because these are the body's methods of eliminating waste products, inflammatory byproducts, as well as toxins. So, a key organ that we look at, of course, is the liver, where most of the hormone metabolism, toxin metabolism is conducted in order to excrete these waste products from the body. So we talked about N-acetylcysteine previously in regard to its use as a precursor for glutathione. So NAC also helps to support healthy liver detoxification alongside cruciferous vegetables, which I've shown here. So cabbage, broccoli, cauliflower, kale, bok choy, can be very, very helpful as food sources of sulforaphanes alongside garlic and onions to facilitate healthy detoxification. Having daily and regular bowel movements also helps with this process. And, when I'm working with patients who are struggling with both eczema and constipation, we do prioritize restoring healthy elimination pathways first and foremost, because if your body isn't excreting the toxins, then of course they're recycling and further triggering the immune system and the inflammatory response. So we ensure that on a daily basis, we are getting enough fiber, and that's about 20 grams of fiber a day, 1.5 liters of water. And if my patients are still struggling, oftentimes what I'll add on is magnesium citrate, which acts as an osmotic laxative, meaning that it draws water into the bowels to hydrate the stool so that they're not so hard and not so difficult to eliminate. And then, of course, there's the option of adding on IV therapy to the treatment. So IV therapy is the infusion of nutrients such as glutathione, B vitamins, and other minerals in through the circulatory system in order to alleviate that inflammatory response by supporting healthy detoxification. And glutathione, as I mentioned previously, is a very, very strong and potent and concentrated anti-inflammatory agent. So it can also be used as a tool to dampen that inflammatory response, which oftentimes triggers those eczema flares. So when we are working on addressing the eczema and alleviating eczema flares, in addition to addressing those underlying internal systems, we also work on repairing the external skin barrier. And one of the nutrients that I look for when recommending skincare products to my patients is to look for that ceramide content. So ceramides are naturally occurring waxy substances that form the outer layer of the skin. And what they do is they provide more of that occlusion so that moisture and water is trapped within the skin barrier as opposed to being lost. And a fragrance-free all over body moisturizer that I usually recommend is the CeraVe moisturizing cream. It comes in a white and blue bottle that you can easily find at any pharmacy um, or store. So it's super ubiquitous. You can find it pretty much everywhere. I also recommend omega-3s as a source of anti-inflammatory nutrients to help to strengthen that skin barrier, which also provides hydration and moisture. And we always discuss the 3 minute rule. So, what this means is that within 3 minutes of getting out of the bath or getting out of the shower, oh, sorry, you are applying that moisturizer in order to seal the skin barrier to prevent further water loss due to, for example, the heat of the water or shower opening your pores. And then, of course, we work on strategies to manage stress. So, whether that's incorporating a more regular physical activity or exercise routine to regulate that cortisol or stress response. Aerobic activities such as running, jogging can also enhance endorphin release, which also can be very, very beneficial for mood. Getting enough quality sleep is also very important because of that melatonin release during sleep. Melatonin is not only a very powerful antioxidant and anti-inflammatory, but restorative sleep also helps to provide regeneration to the body and to the tissues and does have inherent healing properties as well. So we work on strategies to support sleep quality, whether it's utilizing nutrients such as magnesium, focusing on sleep hygiene practices such as avoiding screen use within the last hour before going to bed, or ensuring that your bedroom is sufficiently dark, temperature is not too hot, not too cold, avoiding caffeine, for example, in the afternoon, because caffeine can impact sleep quality for many of my patients. So working on those strategies to instill healthy sleep duration and deep sleep is a key component in addressing the eczema and to reduce the frequency of flares. And then, of course, utilizing or incorporating meditation practices such as journaling, meditation, or yoga can be helpful. So, the Calm and the Headspace are apps that many of my patients use just as short meditations before bed to help promote that relaxation response that's more conducive to sleep. I also perform acupuncture within my practice to support and alleviate stress, to also work on improving sleep quality and sleep duration, as well as relaxation. So acupuncture is performed according to the principles of traditional Chinese medicine. So I will utilize the different meridians. Oftentimes, in traditional Chinese medicine, it's a combination of the heart meridian, spleen meridian, as well as liver meridians that are often involved in this stress response. So by selecting acupuncture points to address these meridians, we can open up the meridians, allowing for healthy qi and blood flow to support and nourish the body. So the strategies that I've just discussed are often incorporated within my primary plan for addressing the symptoms and the flare-ups um, that that are often part of that eczema picture. And what we'll be discussing now is more of a maintenance plan. So, like once you're in between flare-ups or once you've just recovered from a flare, these are the strategies that will be important for us to consider and to utilize in order to prevent future flares. So what this is looking at your skincare routine, being very, very mindful of any skin irritants that you're exposed to, maintaining healthy hydration and diet, as well as addressing the environmental factors that may be contributing to your flares. So, first and foremost, in order to protect that skin barrier, we are moisturizing very, very regularly. What I recommend is at least twice a day, especially after bathing or showering. And as I mentioned, there's that 3 minute rule. So as soon as we get out of the bath or shower, we are applying that moisturizer within that 3 minute mark. And this really helps to lock in the moisturizer, preventing dryness, which can further irritate the skin. And what we're doing here is, again, reducing that skin barrier permeability so that there's less water loss. We are avoiding long, hot showers and instead are opting for shorter, warm showers. And this prevents further water loss and hydration loss. Colloidal oatmeal is an ingredient that can be very soothing, nourishing, and moisturizing to the skin. It can be really helpful for alleviating itch as an alternative to steroid creams. And I find that the Attitude line is really, really good because it has about a 2% concentration of colloidal oatmeal, which is on the higher end compared to other products that are widely available. And it's something that is very, very helpful for alleviating the symptoms so that we are scratching less and reducing that risk of getting stuck in that itch scratch cycle where the more you itch, the more you scratch, and the more you scratch, the more itchy you feel. So that is a more natural alternative for alleviating that itch. And of course, whenever we're trying new products, I usually recommend conducting the patch test where you're applying the cream or product to a very small patch of skin and observing for an allergic response before applying it to the whole body, just to reduce the risk of a full-blown flare up or sensitivity response. We're also mindful of reducing the irritants. And what I always recommend is prioritizing clothing that is light, that's breathable, using natural fibers such as cotton, synthetic materials, or even wool, which are denser or more scratchy. Fabrics can irritate the skin, especially if the clothing is tight and causing more friction onto the skin. So really looking at that piece, as I mentioned before, really prioritizing fragrance-free skincare products as well, particularly in soaps, moisturizers, skincare, and makeup. And then, of course, looking for fragrance-free detergents as well when washing your clothes so that those irritants aren't being exposed directly onto your skin. And then being very, very mindful to wash your bedding and clothing very regularly to reduce dust mite exposure, which can also trigger that inflammatory response, which can cause a flare in your eczema symptoms. Maintaining a healthy diet as well as ensuring adequate hydration during the day is also really, really important to mitigate those flare-ups. And what water intake should look like is at least 1.5 liters per day, being mindful that fluids that contain caffeine, such as black tea or coffee, can be more dehydrating due to the fact that they can irritate the bladder and cause more frequent urination and water loss. So, what I discuss with my patients is that we are having either plain water or water with lemon or sparkling water in addition to the other fluids that you're having throughout the day. We're also avoiding any known food triggers, especially during the flare-ups, to allow your immune system to calm down without there being just constant triggers, triggering that inflammatory response underlying the eczema flare. So here I usually find that even just eliminating gluten for a couple of weeks can be helpful to alleviate your symptoms. We already discussed omega-3s as being a source of healthy fats. And what you can also utilize or incorporate into your day to day, especially through your diet, are the unsaturated fats such as olive oil, avocados, nuts and seeds, omega-3s through fish intake once to twice a week, and fattier fish such as salmon, mackerel, anchovies, and sardines are very rich sources of dietary omega-3s. But of course, taking omega-3s or fish oil as a supplement is also an option. And usually what I recommend in terms of omega-3 intake is around 2 grams a day of EPA and DHA in combination. EPA, DHA being two particular omega-3 fatty acids that are found in food, fish, as well as the supplements. And then, of course, prioritizing that fiber intake, not only to support that bowel movement regularity, but also blood sugar regulation, which can help to prevent that inflammatory response, can also help to support digestion. And it's a source of prebiotics, which help to nourish probiotic bacterial strains, which can help to modulate that immune response. And then last but not least, we're looking at those environmental factors. So during this time of year, when it's cold, we're using a lot of central heating or radiator heating within the home, which can cause the air to become very, very dry. And when the air is dry, the skin tends to lose more water and moisture. So I always recommend utilizing a humidifier to replenish that moisture in the air to prevent your skin from drying out. Using an air purifier can also be helpful because it's a way that we can remove irritants from the air and from the environment. Being mindful of drastic weather changes in particular, whether it's being too hot or being too cold, and dressing appropriately in order to stabilize body temperature is also very important. And then, of course, avoiding exposure to secondhand smoke whenever possible, because tobacco smoke can actually damage the outer layers of the skin, which leads to that more permeable skin barrier, which again, can often trigger that inflammatory response due to more irritants entering the skin, triggering those symptoms that are hallmark symptoms of eczema, being the dryness, the redness, the itching, and the flaking. And of course, smoke can impact the immune system and impair it from properly being able to fight off infection. All right, so the key takeaways that I would encourage you to take from my webinar is not only, why your eczema may be so persistent and maybe so stubborn, but also recognizing that this is very much an inside out approach, and we can't just rely on topical treatments on the skin, because the underlying triggers or the underlying causes of eczema really do stem from the inside. So it's so important that we utilize a combination approach that addresses both the internal systems as well as the skin barrier, in order to not only alleviate your symptoms, but also to prevent the frequency and severity of future eczema flare-ups. Because unfortunately with eczema, it oftentimes is a lifelong condition, but one that can be very, very well managed so that it's not so negatively impacting your day to day with discomfort and with stress. So I hope that you found this webinar helpful, and I've provided my contact details here. So I am taking patients at my clinic at Naturopathic Living. And I'm happy to provide a complimentary meet and greet so that we can further discuss your skin health and your skin goals. I'm also launching another session of the Radiant Skin Reset program in 2026. So please look out for those updates there. All right. So if you have any additional questions, feel free to send me an email. And thanks for joining me tonight, and thanks for taking time out of your day to join me in this discussion about eczema. Hope you found it helpful. Have a wonderful night, and look forward to seeing you soon in my practice. Take care.